Fatma. Our next delegate is Rani Sardar from SOS Children's Village School, Quetta.
Assalamu alaikum. My name is Rani Sardar. I am studying in Ikra Army Public College. I belong to Quetta, Balochistan. I am here to participate in the 31st International Children's Health Conference organized by Hamdard Foundation Pakistan on the occasion of World Health Day 2023. It is an honor for me to be here in this conference, and I sincerely thank Hamdard Foundation Pakistan for providing me this opportunity to speak on the theme Health for All. Health for all means that health is to be brought within reach of everyone in a given country. And by health is meant a personal state of well being, not just the availability of health services, a state of health that enables a person to lead a socially and economically productive life. Health for all demands ultimately literacy for all. Until this becomes reality, it demands at least the beginning of an understanding of what health means for all. Health for all depends on the continued progress in medical care and public health. The health services must be accessible to all through primary health care, in which basic medical help is available in every village, backed up by referral services to more specialized care. Health for all implies the removal of the obstacles to health, that is to say, the elimination of malnutrition, ignorance, contaminated drinking water, and unhygienic housing quite as much as it does the solution of purely medical problems such as lack of doctors, hospital beds, drugs, and vaccines. Health for all became the slogan for a movement that was not just an ideal but an organizing principle. Everybody needs and entitled to the highest possible standards of health. The principle remains indispensable for a coherent vision of global health. Turning that vision into reality calls for clarity both on the possibilities and on the obstacles that have slowed and in some cases reversal progress that will mean longer, healthy lives for millions of people, turn disappear into realistic hope and lay the foundation for improved health for generations. As an individual, I hope to support this cause and would urge you to do so by helping people around us. People who work for us should be provided the same health care like us. Let's open our eyes and hearts and provide good health care, clean water, and proper nutrition to people who work for us and low income people communities around us. Let's promote charity hospitals. Many poor people are not aware that these services even exist and how they can be approached. Let us raise resources and even save some of our pocket money to donate to such hospitals so that they can treat more and more poor people free of cost. Thank you.
Thank you, Rani, for your speech. Health for all means that health is to be brought within reach of everyone in a given country, and by health is meant a personal state of well being, a state of health that enables a person to lead a socially and economically productive life. Now, I would like to play the video of the last delegate, Vardawari from Karachi Public School, Karachi.
Teachers, honorable delegates, and fellow students. Assalamu alaikum. I am Varda Gauri from class 5 representing Karachi Public School Gulshan branch. And today we have come together to observe the theme Health for All, a day that reminds us of the vital importance of good health and well-being for all people worldwide. This year's theme, Building a Fairer, Healthier World, underscore the urgency of addressing health that persist in our society. Respected President, as we look around, we see that not everyone has equal access to health care, nutrition, food, clean water, and safe living conditions. Therefore, we must strive to create a world where everyone can live a healthy and fulfilling life. The World Health Organization states that health is a human right and no one should be left behind. Respected President, we must work tirelessly to overcome the social, economic, and political factors that conclude to health inequalities and ensure that everyone has access to quality health care. Another famous quote is, "There can be no happiness without good health." Honorable delegates, as we celebrate World Health Day, let us commit ourselves to building a fairer, healthier world. Let us work together to promote healthy habits, improve access to healthcare and education, and advocate for policies that addresses the root cause of health inequalities. Let us work toward a world where everyone can enjoy this precious wealth of good health. Thank you. As Mahatma Gandhi said, it is health that is real wealth, and not piece of gold and silver. With that said, I would like to conclude my speech and thank you all for giving me the opportunity to speak on such an important topic of life. I am grateful to Hamdard Foundation and Hamdard Public School for hosting the theme Health for All, and together we can make this world a better place so everyone can enjoy healthy and cheerfully life. Thank you.
Thank you. Now I would request Dr. Jamshed Ahmed, one of our guest of honors, head of WHO Sub-Office Sindh, to please address the delegates.
Bismillahirrahmanirrahim. Assalamu alaikum. Madam Sadia Rashid, President Hamdard Foundation, Dr. Azra Picheho, Minister of Health, Sindh, Professor Dr. Javed Akram, Minister of Specialized Healthcare and Medical Education, Government of Punjab, my colleague Dr. Sara Salman, other distinguished participants and delegates, Assalamu alaikum. It is always an honor to be part of such activities where our young generation, they talk about the issues that we are facing and working for. Recently, we have been assembly a couple of weeks back at Lahore in a children's library, and I was impressed to listen the quality of speeches by our non-Nihal speakers, as well as the resolution that was discussed and passed over there. And it was again highlighting the theme of today's World Health Day, which was Health for All. As you know that today we are here to commemorate World Health Day, and it is also a celebration of 75th anniversary of WHO. WHO came into being back in 1948, and we have been listening to our speakers on that contribution that years, along with the support of member states, including our country of Pakistan, as well as the Hamdard Foundation role that has been highlighted here. It is very impressive. Still, there are many things to do. And WHO, along with our health partners and member states, is striving hard to improve the health and wellness of our public. Pakistan is again a country with high population and facing many challenges as far as health is concerned. But we are also blessed that we have a very resilient population that we have witnessed during our fight against COVID-19 pandemic and this huge flooding that affected 3 provinces of Pakistan. But we have been through these challenges, and we need to work more eagerly and more focused work to get this target that we are listening, health for all, at all levels, despite whatever the economic and social sector they are representing. WHO on this World Health Day has came up with a strategy with 5 pillars that we call as 5 P's of WHO to attain health for all. So these 5 P's are promote health through our health education, through awareness, involving communities, so that all promotive actions are undertaken and adopted at all levels. And I'm thankful Hamdard Foundation that they are working on that area from very beginning and very effectively. And this is the example that we are involving our younger generation and inviting them to discuss and ponder upon on the health promotion issues, and we are happy to listen their thoughts during this World Health Day event. Second P is providing health through equitable and quality services. And third P is protect health, and which is providing the infrastructure and architect of the health that is resilient and fulfill the needs of our countries and all the population. And also, fourth P is power health. Power health means that we need to harness research and invite new technologies to undertake all the challenges and face our health issues more efficiently. And last P is perform for the health, which is basically for WHO, so that they can lead, guide the member states and other agencies working on the health and perform for better health and well-being. So I am very thankful to Hamdard Foundation, Mr. Ali Bukhari and other delegates, and especially Madam Sadia Rashid for hosting this important event. And I am congratulating all the delegates who have prepared their speeches and contributed here. God bless all of us. Thank you very much.
Thank you. We have received video message of another guest of honor, Dr. Javed Akram, Minister of Health, Government of Punjab. I would like to play the message.
बिस्मिल्लाहिर्रहमानिर्रहीम। वर्ल्ड हेल्थ डे एक इंतहाई अहमियत का हामिल दिन है, जिस दिन हम उजागर करते हैं कि सेहत का किस कदर ज़रूरी होना हर एक इंसान के लिए ज़रूरी है। और इसकी आज इस दफ़ा तो थीम भी यही है, हेल्थ फॉर ऑल। चाहे बच्चा है, चाहे बूढ़ा है, चाहे औरत है, चाहे मर्द है, सेहत होगी तो आगे जाएगी। इसलिए सेहत आमा के लिए बहुत इम्पोर्टेंट है ये दिन कि इसको उजागर किया जाए, सेहत की अहमियत को। और मैं बहुत शुक्रगुजार हूँ हमदर्द फाउंडेशन का कि वो इसको इस तरीके से उजागर कर रहे हैं और इसका भरपूर फ़ायदा हासिल कर रहे हैं कि हेल्दी नफसियाती तौर पे इंसान होगा, जिस्मानी तौर पे होगा, फिर ही वो अपने लिए भी कुछ कर सकेगा, अपने ख़ानदान के लिए और मुआशरे के लिए कर सकेगा। इसलिए मैं समझता हूँ कि हमें अल्लाह ताला की कुरान पाक हमारे सामने है और फिर हमारी सुन्नत रसूल सल्लल्लाहु अलैहि वसल्लम है। इससे बेहतर किताबें नहीं हो सकती अपनी नफसियाती और जिस्मानी सेहत को सही रखने के लिए। इसमें तमाम नुस्खे मौजूद हैं। और उसके बाद जो सबसे ज़रूरी है, ये रमज़ान का महीना है और रमज़ान हमें सब्र सिखाता है, इत्तेदाल सिखाता है, फॉरगिवनेस सिखाता है, एक दूसरे को माफ़ करना सिखाता है। तो ये अगर चीज़ होगी तो हम बहुत सारी बीमारियों से वैसे भी बचे रहेंगे। और जाहिर है सिगरेट नोशी वगैरह, अगर आप 14 घंटे नहीं सिगरेट पीते तो एक दिन भी नहीं पिए, 2 दिन भी नहीं पिए, पूरी महीना नहीं पिए, पूरी उम्र ना पिए, तो ये सिगरेट से छुटकारा हासिल हो सकता है। मैं उम्मीद करता हूँ कि हमदर्द फाउंडेशन के साथ मिलकर हम ये वही पाकिस्तान बनाएंगे जो एक खुशहाल पाकिस्तान हो और बहुत हेल्दी पाकिस्तान हो।